Hello, everyone. My name is Dr. Sylvia Vito. I'm in the healthcare space. I work in the pharmaceutical industry, and I've been privileged to have been a part of the amazing WomenLift Health Cohort 2023-2024. And as part of my conclusion of the program, the project that I focused on is the importance of promoting the health of the young women in urban slums in a bid to prevent non-communicable diseases. So in my next slide, I'll just summarize to you what we already know. NCDs continue to pose a significant threat to the youth of this country, and especially the ones who live in the slums. Why the slums is because we see that in these slums where I've worked in the last 8 to 9 years through different programs, is that we saw that young girls and women and the youth generally tend to have exposure to early sexual activity, lack of physical exercise, harmful use of alcohol, substance abuse, poor diet, and all these combined tend to propagate early onset of NCDs. What we know through the last 8 years of the work I've done in Kibera and Mathare and in the desktop review that I did in my presentation is that educating the young girls and women in slums, in the urban slums, has made a significant improvement in decreasing the risky behaviors that we see that tend to perpetuate NCDs. And that's what I'll take you through. If you look at my next slide, on the observation, and this is just a summary of the desktop review that I was able to do, is that we're able to reach over 82,000 young women directly, and these were mainly girls and young women. The percentage of young girls and women was over 60%. The other thing that we focused on was capacity building, and capacity building in this case was not only of the frontline workers who work in Kibera and Mathare, but also through community dialogues, because I've been able to participate twice a month. I go to Kibera and Mathare, and we participate in community dialogues where we bring together women, and in another group we bring together girls, and sometimes, of course, men and young boys to talk about NCDs and the behaviors that we have that tend to perpetuate NCDs and what more they can do, and also giving them skills and capabilities, how they can improve either eating properly, how they can avoid early sexual activity, how they can avoid tobacco smoking and the risks of the same. So we've been able to conduct quite a number of community dialogues and work with the frontline health workers who are over 3,000. And in my observation and in this particular report is that we're able to see that through knowledge enhancement, the decrease, we reported at least 93% improved awareness through these educational programs compared to 66%, which is when the program had started. So when I did this review, if you're able to have an improvement of 66 all the way till 93%, that goes a long way in ensuring that women and girls in our urban slums feel more capable and their better understanding of how they are in charge of their health and why, if they do certain things, what does it result into in perpetuating NCDs. Other than knowledge enhancement, behavioral change was the other big thing that we saw. There was very big positive shifts observed in the smoking rate, 5.9% at the end-term evaluation compared to 47.2 at the baseline level. And in terms of inadequate physical activity, it was 16.3 at end-term evaluation compared to 71.7 at baseline. And for us, this is very positive behavior modification, because I think what is sustainable when it comes to prevention of NCDs is that people must understand the why. Why is it I need to stop certain things? Why do I need to do better at certain things? Because it results into these risky behaviors. It results into non-communicable diseases such as hypertension and diabetes. But when you speak to people in the slums, things like diabetes, which we call sukari, might be so far-fetched. So you need to bring it down to things that they can see and relate and understand. So I think this has been quite a significant improvement in the urban slums. And of course, healthcare services enhancement. This is through working together with the youth-friendly healthcare services, which are available in Kibera and in Mathare as well. And we saw increasing satisfaction of girls being able to seek healthcare services, and women as well, increasing from 18.1 all the way to 71. And I think this goes a really long way to improve the healthcare outcomes of the girls and women in the slums. So just to summarize again, what are some of the outcomes and recommendations that we make? We must continue having a gender-specific approach to how we deal with girls and young women who face unique healthcare challenges. And these things are as simple as, we know that some of our girls and some of our young women in the slums will have exposure to unprotected sex in exchange for very simple things like money for them to buy pads. What do we do to prevent to enable them to have better sexual, reproductive, and healthcare rights, and to ensure that they understand these and they can access better programs where they don't need to expose themselves to a lot of risks, okay? Secondly, integration of sexual reproductive health rights in the slums as well, from family planning, menstrual hygiene management, sexual health education at an early stage becomes very critical. If we educate them, we empower them. And these are some of the recommendations that it needs to be made a part and parcel of the wellness conversations that we have with women and girls, even from schools that are in the slums or even the young youth activities. Emotional well-being, mental health, and supporting them to understand that they should not be ashamed of how they feel or some of the risks that they face, that they should be able to go to more user-friendly facilities or find healthcare workers who can actually, who they can reach out to. Continued NCD prevention. It's not a once-off activity. For the last 8 years, we've been doing these activities through programs like the Plan International Young Health Program, but these need to be encouraged and supported, even through women in leadership like myself. To date, even after finishing the program that I did in Kibera and Mathare, I still continue to work with the young people to give them various modes of support to ensure that NCD prevention and education continues. Community engagement cannot be left behind, and that means working together with the communities and with the county governments, because at the end of the day, the moment we involve a lot more of the county facilities, then it becomes more a sustainable solution. And one of the things I've been able to do with them, and you've seen some of the pictures, is even doing things like tree planting, during the International Women's Day, having activities with them, so to make this a continuous activity with them. Policy advocacy cannot be labored, that this becomes important to make sure that the needs of the young women and girls in the slums are addressed because they have unique challenges and their voices continue to be heard. So I think these are some of the things that I would say are the recommendations that I would say we probably continue to look out. And this is what I've been able to do as a summary of the desktop review that I did for the work I've managed to conduct in Kibera and Mathare. But all in all, in my work in my journey at Young Women Lift Health, there's been a lot of learning beyond just the project that I've been able to do. I've been able to connect with other female leaders in the healthcare sector, and this made me feel that I'm not alone. Even when I'm struggling with work-life integration, I am not alone. I've been able to have a lot of coaching, one-on-one sessions with my coaches, and also mentorship. And this increased my self-awareness around understanding my emotional intelligence, my leadership style, managing, how do I manage my emotions? And this really goes a long way in how I show up to the people that I serve, in how I show up in the communities, how I show up in various assignments that I'm given. Positive conflict resolution. Through the work that we do, there's always tension, there's always unexpected situations or conflicts or just challenges. Through this program and through my coaching, directly with my coaching and with the group session that we've had, I've been able to understand how do we make sure that we have constructive dealing with conflict that will continue to be a part and parcel of our lives. Then crisis management. The work we do, there's always one crisis after the other, and even at home sometimes. So how do I manage to have practical skills and tools that enable to me a better leader, a better version of myself, and to be a better female leader that shows up strongly and positively and makes an impact in society. So I really want to say a big thank you to Women Lift Health for enabling me to be a better version of myself. And this learning is a continuous process. It doesn't end here. Thank you very much.